Well, hello, and welcome to the second module of Lifestyle Medicine. So we're off and running for the course, and this module we get to start in with the book. And so I'm going to, in a little bit, I'm going to go over a few of my thoughts about the first two chapters of the book that we have for the assignment for this week. But just I wanted to cover the logistics as far as what was due for this week. So we have chapters 1 and 2 in the book, and then this will be your first opportunity to do the worksheets that go along with the assigned readings. Should be pretty self-explanatory. They're just sentences that are taken straight from the reading with words missing. You just fill in the blanks, submit those, and they should be pretty easy points for you. Also, we'll continue, as we do for every module, in doing a discussion for this, and so as consistent through the whole course, the first posting, your original posting, is due on Thursday by 11:59 at Central Time p.m., and then 2 replies by Sunday at 11:59. The other point, the other assignment for this is by Sunday night, you should submit your paper topic for your term paper for this semester. This is just the topic and then a 100-word summary of what your paper will be about. So this will take a little bit of preparation on your part, obviously thinking of a topic, doing some literature searching on it already to find out some information about it to be able to put into the 100-word summary. The topic of the paper, as you can see from looking through the syllabus, is your choice. It has to, of course, be related to lifestyle medicine, but it's your choice otherwise. And that is due by Sunday at 11:59 also. The full paper then is due at the end of the 4th module. So paper topic, summary by the end of the 2nd module, then you have another 2 weeks to complete the paper. So if you have any questions on the assignments, let me know. All right, so what I wanted to do was just briefly go through a couple of points about my opinion on some of the topics that we're covering in the required readings for this week. Those are in chapters 1 and chapter 2. So chapter 1, as you'll see, is an introduction to lifestyle medicine, and then chapter 2 we get into actually talking about behavior modification. One of the other things I wanted to make you aware of before we started into this is how the book is laid out. And you'll notice I have it in front of me so that I can talk through some of these points with you just directly from the book. But after you get through chapter 1 and the overview of it, then it gets into what I call the core elements of lifestyle medicine. So those are behavior modification. I'll tell you why I put that first in a minute. Physical activity, healthy eating, sleep, stress, alcohol, and smoking cessation. And then the 3rd section of the book incorporates those concepts or those core elements into chronic diseases. And in this particular text, we're covering obesity, blood pressure, cholesterol, diabetes, and coronary artery disease. And then there's a 4th section, which is talking about the application of lifestyle medicine. So how do you document it? And then the last chapter is on tools. Now, this is something important that we'll talk about throughout this course is our tools for lifestyle medicine, but also you'll get into this when you take the HLM 451 course in health and wellness coaching. You'll be using this book foundationally for that, so this material will carry over directly to that, incorporating these concepts into case studies, and those tools will be used in those case studies also. So as we work our way through this book, that will become familiar to you on hopefully what the tools are, how to use them conceptually, and then in an application way, we'll do that in 451, is to apply these tools to case patients, or case individuals, or case subjects, whatever you want to call them. So the way the book is laid out is at the end of many of the chapters is an introduction to 1 or 2 of the lifestyle medicine tools that are in the back of the book. So those are important for you to read through, so you are familiar with those. It gives a bit of a description, and then you'll want to flip to the back of the book and look at the actual tool to see what it actually looks like. There's a bit of a description on how it's used, and you should know that we use these tools on a daily basis in our cardiovascular and diabetes risk reduction program for our employee wellness program here. And so these were all actually created for that program and then put into conceptually into the text as you see it here, and then as you get into another book that you'll use, a workbook, a lifestyle medicine case study workbook that you'll use in the health and wellness coaching course, the 451 course. So by way of introduction, I'm not going to be the spoiler here, but so I want you to read the text. But lifestyle medicine in general, as we may have talked about in the last module, really gets to trying to get to the root cause of what you see manifest as a health issue. So the health issue may be obesity, it may be diabetes, it may be high blood pressure, but let's back it up and find out what the real reasons for this in that particular individual. And again, there may be consistent themes across individuals, but they are unique to each person. That's something to keep in mind always, is that even though something like low physical activity or high calorie consumption may look like that's the root cause, there's something behind that also. And that's where we want to get to, is to say, okay, well, why is this individual that I'm working with not exercising? Is it a lack of knowledge? Is it a lack of motivation? Is it something else, an unsupportive environment? Maybe income is low, there's no safe place to exercise. All of those factors are important to try to get to. We don't want to just stop at saying, well, this person doesn't exercise, so my recommendation is go exercise. That's not enough. It's helping them. This is what is important for you to get to in your mind, is finding out why for that person, and then developing strategies with that individual to make that component successful for them. Whatever it is, healthy eating, sleeping more, reducing stress, drinking less alcohol, whatever the case may be. And so that's what lifestyle medicine really is about. The name isn't great because it seems like it's medical, and it is a lot for the most part. It's kind of in the biomedicine world of thinking that westernized medicine is, but where we're taking this is something of an expanded version of that, in looking at the social and cultural context that surround those real reasons of why people aren't doing the healthy lifestyle behaviors that would allow them to thrive in the world that they live in. So that's kind of the initial context of this. So the chapter gives you some definition for lifestyle medicine. It goes into some background, what I usually refer to as justification for this, like we need it anymore, but I still am in that mode, and probably always will be, to justify why this is needed. So it talks about the state of our health in the United States and in most Western wealthy countries fall into that category of the state of our health. Talks about a bit about drug therapy and its relation to health care. And then the forecasting of what health is predicted to be like in the future if we continue on these same trends in the U.S. And then it explicitly goes into, let's make a case for lifestyle medicine, given that information. So then lastly, after you get through the summary and test your knowledge questions, don't forget about the practical application tools, and this is what I meant earlier about talking about lifestyle medicine tools. So in this, it particularly introduces the tools of the Lifestyle Journal and the Composite Lifestyle Index. Both of these were created here at Creighton and specifically used for the cardiovascular and diabetes risk reduction program, and used very successfully. So please look at those because those will come up in the application part. When you take the 451 course, you'll be using both of those tools. So then that's your introduction part. But getting into the core elements, behavior modification is that first chapter. It's chapter 2, but it's the first chapter in the core elements section. That's purposeful because behavior, health behavior, or what you do on a day-to-day basis and why you decide to do that is really what we call the rate-limiting step of lifestyle medicine. You can work a fabulous lifestyle medicine program with suggestions and all of the things that you're supposed to do according to guidelines for physical activity, nutrition, and so on. But if you forget about the behavior, the person behind it, and implementing it for that individual, then it's just a good academic exercise and nothing more. So it really doesn't help anyone. And that's the point we need to remember, because much of what we do, unfortunately, in our Western medical system, in our biomedicine thought these days is, and has been, not just today, is to say, I know what's wrong with you. Here's my advice based on the science. Now go away and do it because I said so, because I'm the expert. And that seems to be the way a lot of things are practiced now. And that's certainly not what we're about. This is all about the individual that you're talking with. It's not a transaction from the healthcare provider or the health and wellness coach to an individual. It's about a relationship, and if it's a true relationship, then I care about you and you care about me, and so we're going to work through whatever the behavior part looks like. So that's why this is the first chapter, because it's probably one of the most important that's in the book. Unfortunately, it is a brief overview of what this is, and it goes into a couple of key concepts for you to know about, but please realize this is introductory. We're talking about adherence, and it's a page on adherence or a page and a half on that, and just to get you introduced to it. And the next section is on theories, on behavior modification theories. There's a whole very comprehensive textbooks written on just theories on health behavior theories, and we're just introducing 2 in here. And these are purposeful to introduce these 2 because the first one, the social cognitive theory, is important because it helps us understand that there's a social and cultural, very important component to someone's thought process of why they decide to do A or B. Why do I decide to stay in bed rather than get up and exercise? Or why do I decide to eat this instead of this? There's a lot of complex socially, culturally related components that go into those decisions on a day-to-day basis or on a long-term basis for people. And that's what partly what this theory introduces to you. Again, it's a brief overview of it, but I wanted to put it in there because that's important. The second one is the trans-theoretical model of behavior change. And that is really aligned more with biomedical thinking, or what's sometimes referred to as reductionistic thinking, in that there's a problem, there is one solution as we reduce our thinking and our critical thinking into pinpointing one culprit of an outcome. And so this sort of falls into that realm of thinking, but Prochaska, who created this, does say that people go, you'll understand this as you read the chapter, but there are stages of behavior change that you go through, say for considering to exercise consistently or for stopping smoking. And he notes that people will, as they go through the stages, may go backwards and then go forwards and then go backwards and go forwards. And it's important to keep that in mind, that it's just not a forward and then you stop. You may regress and then do some progression and then regress again. But this is to try to get thinking about one stage that someone is in. And it probably is more complex than that, but it does sort of help by way of introduction of what behavior modification is, to read through this. Based on that, actually, we have developed a tool of a readiness and a confidence to participate in healthy lifestyle behaviors. And that's in your toolbox here in the textbook, the toolbox that's in the back, and there's an explanation for it in this at the end of this chapter, also on the tool that we use to implement that trans-theoretical model. It's a very practical tool to use, and we have had great success trying to implement it, or not trying, but implementing it, and then developing strategies based off of that, of what to do for lifestyle medicine activities for folks. So those are the two chapters. That's an overview of the assignment and at least my take on this. If you have any questions, let me know. I'm looking forward to interacting with you again in the discussion board on this. So we'll see you again in Module 3. Thanks.